So last but not least, we have Yasmina Hamdaoui, who is the Pre-Operative Assessment Pharmacist at Betsi, Cadwaladr in Wales, who also helped set up the Green Health Wales network. She's been featured on BBC News recently, and today we will learn about the importance of cross-departmental and multi-professional working in a path to improving environmental sustainability in our healthcare practices, as she discusses how the Green Health Wales network was established. Yasmina, over to you.
Thank you, Mia. And just checking you can see the slide and hear me okay?
Yeah.
Fantastic. Before we get cracking, thank you so much for organising today. I think everybody is feeling very motivated and informed after the amazing speakers, and I know how much hard work it's taken you to organise all this, Nina, so I'm sure we'll have a round of thanks at the end, but just want to start with that. So yeah, as Nina mentioned, I've been fortunate to be a founding member of our hospital green group and a national network here in Wales. So there's lots of things we've heard today, which I think is going to leave us motivated to take action. And I hope there's some successes I can share from our work that will be useful for all of you attending today, and some lessons that I can share to help you as you hopefully go forth and do some positive action. So we will start with talking about our hospital's green group. So Ysbyty Gwynedd Green Group is a cross-departmental group with people who are determined to improve our environmental sustainability locally, and the story with this really started when one of our junior doctors, Tom, in his first year of foundation training here with us, simply asked the question about what was going on in regards to sustainability and the environment. He was quite aware of the health and climate links and just made that simple inquiry. And having the response that there really wasn't very much that he could personally get involved in, he's encouraged to submit what we have as a Bevan exemplar project here in Wales, which is a service improvement project based on making the connections to improve the environmental sustainability of our hospital. At the same time, there were interested healthcare professionals and other junior doctors and the like who had a shared interest, and they decided to start with a really quick stall outside our canteen, which is the best place to find people and engage with them. Top tip for you there. And from that, we realised that there was a lot of interest from other healthcare staff, and they gathered ideas on what people wanted to see and ideas on how we could improve. Following this, one of the products of this combined work was the formation of our green group, and this is a picture pre-COVID of some of our members, and as you can see, it's a multidisciplinary group and we have both clinical and non-clinical staff involved. We do have some committee roles, but we are very much self-organising, and a strong value of the group is that we are power sharing. So whether you are a junior member of staff or a consultant or somebody with many years of experience, everyone's ideas and input is valued. We have grown to have over 100 members now, and we've got lots of inputs. And it is also something that people do on a voluntary basis in whatever capacity they have. With all the engagement, which we're really happy to have had, it was often difficult to sort of channel all this energy and the ideas and focus on what to do. And after quite some time, I think the approach we came to decide on was to connect, learn and transform. And this is how we approach the work and the various ideas of projects that we have. So to begin with, when we talk about connecting, it's all about engagement, reaching out to people and getting their interest. I think we've all come today and learned about the links between the environment and health, and it's about raising that awareness and getting people involved. But it's also engaging the key stakeholders, which we need to make projects and this organisational change happen as well. The next thing is to learn, and as well as increasing awareness, it's the educational resources as well. So it's making sure that we as a team and as members of the group understand the various intersections between health and the environment. It's also making sure we have resources available and educational sessions tailored to different specialities or departments within our health board and our hospital. And then having engaged people and raised awareness and some educational events, that's when we can start with the transformative projects, which is what we want to see. We want to see change, we want to see reduced emissions, we want to see a cleaner environment around our local hospital and beyond. But you really need a cycle of all these things to make that work. So what did we achieve having done all this? Some successes that you can hopefully be inspired by. In terms of connecting, we were really fortunate to be able to collaborate with lots of different organisations. We were featured in the NHS Sustainability Impact Report in 2020 for our cross-departmental working. We have worked with organisations such as the NHS Forest and Magnificent Meadows on some biodiversity work. It was really key to work with our quality improvement department because lots of the projects we undertook were improving financially, clinically, and there's lots of benefits to be seen. So there's really good training available from them. We were featured in the Office of the Future Generations Commissioner for Wales as a case study on how our work links with a healthy and prosperous Wales for the future. We joined up with clinical networks such as the Welsh Environmental Anaesthetic Network. We were involved in some research work as well. So Green Operations was a research study looking to identify the key questions in working towards more sustainable surgery. So we were a partner organisation in that. And we also had some media appearances, as Mina mentioned. So we've been featured in the BBC and local Welsh S4C on 2 years in a row now, just showing the progress that the NHS and that we're making locally to drive a more sustainable healthcare service. In terms of the learn and education side of things, some of the events we organised were things like Grand Round for the hospital, and we had newsletters going out. We had some departmental educational events. So as you'll know, anaesthetics are very keen on being a bit more green. So they would have sort of tailored educational sessions for them and other departments. We also had a journal club and just tried to highlight some of the key work going on to engage people in different departments. And then in terms of transform, so there's so many ideas and project streams that we had, and we categorised them into 6 different project streams, which are clinical, energy, waste, transport, food and biodiversity. And this came from looking at the different streams of emissions and what needs to happen to improve our sustainability, and we might need to add oceans onto this in future. So in terms of clinical, we'll just give a brief overview of this because there's lots of stuff going on that we can't cover everything today. But clinical, anaesthetics were very quick quite early on to switch to sevoflurane as opposed to desflurane, with the massive amount of savings you can have there for a very similar clinical effect. We're also in the middle of the nitrous oxide project, having seen the amazing work that Olivia has pioneered up in Scotland. So that's something we're in the middle of at the moment. We're also looking at our inhalers and working with our respiratory teams. And I think from previous talks today, you'll know the importance of collaborating with specialty networks locally, because this can't be done alone. As you as a keen environmental pharmacist, you need to work with the departments involved as well. In terms of energy, we have been working with our estates departments. Traditionally, healthcare professionals might not have much say or are deemed to maybe not have a lot of interest in what's going on in terms of how we power our hospitals. But from the stalls and the engagement we had from members, we actually found that people really did care about this. So the fact that we had a line of communication then with the relevant departments to be able to feed back to the members was really powerful, we found. And we're looking at a refit programme for our hospital now, and identifying where we can be using things like more solar panels, and working with energy services in Wales. In terms of waste, there's lots going on. So recycling was mentioned earlier, and actually in our hospital, we had lots of feedback that people wanted to see more recycling. But when we spoke to the relevant departments, we found out we're actually doing a really good job, and we were recycling about 95% of our waste. So what I'd say with that is, speak to the relevant people, your environmental officers or sustainability officers. What we found is segregation of our waste doesn't happen at source, and it actually wouldn't be very effective for us to have 3 or 4 different bins on every single ward and in every single department. So that wasn't a route we actually wanted, and that's not what happens for us. The waste gets segregated later on. So being able to feed that back to staff was again reassuring, and it is something we're looking at in more detail to make sure we understand our waste streams. But other simple switches, we have recycled paper across the health board. We were part of the pilots of reusable masks in our hospital. We haven't rolled that out completely yet, but hope to in the future when policy allows. The reusable gowns were mentioned by the team from Australia as well, and that's something we've just finished a pilot on and hope to roll out across the health board and hopefully across Wales as well. And we've also looked at things like compostable cutlery, just to reduce waste there. In terms of biodiversity, there's been lots of activity. You know, in Wales, we're very connected to our outdoors, and we've got beautiful mountains. We're right beside the Snowdonia mountain range here in Ysbyty Gwynedd, so we have got some wellbeing groups set up in collaboration with Magnificent Meadows, and that's for our staff and our patients. And on World Mental Health Day, just a couple of weekends ago, we did some tree planting with volunteers from our hospital members, of the green group, from staff and from the community, and it's a really nice event to be able to bring people together and do something and highlight the benefits to well-being, and also do something where you can see now a change in our grounds in the hospital. In terms of food, there's lots of work going on. Our dietitians have been trying to make sure we have a range of meals available which are vegetarian based, so you know, from a climate perspective, that's reducing meat intake, but also from a health perspective, focusing on nutrition as well. We've also been doing some work to look at where we source our food and local sourcing of what we get in our hospital canteens, and what work we can do there in the local community to help improve diets and all sorts of in that area. And lastly, in terms of transport, we have tried to advocate active transport to hospital. One of the things we did was provide a resource with all the cycling routes in the area and tips for things like where you can store your bike at hospital, because it's simple communication sometimes that is lacking in our organisations about the resources already there, and things like the cycle to work scheme available to staff. So it's trying to publicise those things, but also advocating and being the voice from the feedback we heard from fellow members and staff in our engagement stalls, when they would say that the barriers for them to cycle to work, for example, were things like a lack of showers, or the bike racks weren't appropriate. So it's being able to then, having built up a good line of communication with the relevant stakeholders in our organisations, we're able to feed that back and hopefully improve that for our staff. We're also very excited to have some electric cars join our fleet of pool vehicles in the next couple of weeks. So we're excited to have those because they are still needed on occasion to travel between sites. So what we realised, in essence, as I'm sure you can see from there, is that it needs a lot of collaboration. A lot of these projects and service improvement work, when it comes to sustainability, they reach into different departments, and lots of stakeholders are involved. But we also found that the problem with making things improve was that people are often working in isolation, and so there's lots of disconnect and lots of fragmented good work when nothing's really joined up. So once we started seeing success locally, we really wanted to spread this further. And part of innovation work in Wales, we have a Spread and Scale Academy, which is all about scaling up the work you do. And we had a vision of having green groups across Wales. Right now we've got green groups in our 3 main district general hospitals across our health boards. That spans the whole of North Wales, and we're hoping to spread that further. We're also on reflection realised that if we were struggling with making change up here in our hospital in North Wales, and having spoken to colleagues across Wales, we realised other people were in a similar situation where they had some good ideas, or they really wanted to make a change but didn't know where to start. And we also realised that the successes we'd had with projects needed to be shared so that other people didn't go through the same painful process, and that we could advise them on things that they could do to reach that success quicker, because this is a shared outcome, and we need to be sharing our wins and what's got us there as best as we can, so that we can all reach the common goal of being more sustainable as a whole. And with that, we decided we would launch a national network, which was Green Health Wales. And I think we finally said we'd go for the plunge maybe in March 2021. And we launched officially at the end of June, so about 3 months later. So it was a big sprint finish. We launched with a virtual conference, and we were really fortunate that we got engagement from right across Wales. So we had every health board engaged. We had the Chief Executive of NHS Wales open our conference, and we had the Future Generations Commissioner speak as well. So we had really good executive level sort of buy-in and leadership, which was really important to make sure this work is going to be recognised and given the notice that it needs in NHS Wales. But it's also very much an employee-led initiative, and I think the enthusiasm and the passion that is seen really drives this work forward. And we use the same approach here in terms of connecting, learning and transforming when approaching this work nationally. From that, we're able to expand the amount of groups that are involved and develop this network where we've got student societies, primary care practices, biodiversity groups, and different health boards involved. And this is something that is continually evolving, we hope. Our main platform we use is the website that we created, and I encourage all of you, wherever you are in the world or the UK, to visit this, because it isn't just for Wales. We do want it to be open source. I think in England you're maybe a little bit ahead, having Greener NHS set up a little while ago, and the Sustainable Development Unit before that, but there's not as much maybe open access resources on this. So we really wanted our website to be something that anyone could land on and benefit from straight away. So, you know, if you went on the connect part of the website, that is, if you're in Wales, you'll find organisations closest to you, but otherwise, wherever you are in the world, there'll be organisations and groups that you can link in with and network with, depending on your speciality or area of practice. The Learn part of the website has got all sorts of resources and educational things that you can access, whether you want to read things, listen to a podcast, watch a video, do some e-learning. There should be a link there that suits your needs. And then the Transform section is continually evolving with some ideas of things that you can do and projects that have worked that will guide you through those. So what's next for us? Well, we want to continue this work and much the same way as we have been doing, but we also recognise we need this to be integrate to integrate sustainability at every decision-making level in our NHS, starting in Wales. We also want to inform strategy and, you know, get that organisational change that we need. It can't continue to be something that's done by volunteers in their spare time, because the work needs to be integrated and recognised for the importance that it is. And we're obviously going to continue collaborating by developing the network of green groups and speciality networks that we've already started to do. With that, just a small plug here, we have got a network, a webinar event in the beginning of November on establishing your own green group, and anybody's welcome to join that, whether you're in Wales or not, because I'm hoping the information and resources we show there will be useful for anybody who attends. And I'd just like to end with some things that we've learned that will hopefully help you if you wanted to do something similar or embark on some collaborative working, which I think is key to making any change, as we've seen in lots of the examples we've heard from today. I always like to look back on this carbon footprint. This is the one from NHS Wales, and it's a similar chart I know you have from Greener NHS as well. But I think looking at this, and it maps our emissions in the NHS, and I think it just shows you that, you know, sustainability isn't on any one single individual. It's not on any one single department in our NHS. Traditionally, I think estates departments have been, you know, targeted as their energy and emissions and waste management, but it's something that we all have a responsibility, and therefore we all have to engage these various departments and professionals if we're going to succeed. A question we often get is, you know, how did we engage so many people and how do we get people on board? I think you do need to think about things like publicity and media. So, you know, use your social media channels. Most of you who are here today will have heard about the conference via things like Twitter, so don't underestimate the power of that. When you're engaging others and sort of approaching stakeholders, you need to think about things like the science, the policy and legislation. So in terms of the science, it's those links that have been outlined earlier today, the links between climate and health and the various ways that intersects. But look at then things like policy and legislation, because these are things that if people don't choose to do in their organisations, you know, we are being asked to do it in terms of policy and legislation. We always sort of reflect on this little timeline here in Wales, which has got a net zero target for the public sector in 2030. So there's lots of work to be done. We recently had our decarbonisation strategic delivery plan launched, and part of the launch of Green Health Wales was to bring more attention and drive that forwards, really. We're also really fortunate in Wales to have world-leading legislation in the Wellbeing of Future Generations Act, and that legislates that any public sector body has to ensure that the way they are working and acting doesn't negatively impact future generations. And so we're very aware that there's a lot of intersections between health and climate as part of that. So we're fortunate to have that driving this work forward. Having said that, though, as well as the science, the policy, the legislation, the things that enforce this. Don't underestimate how much emotions come into it as well. So we've already heard the story of Ella, and you know, patient stories like this, where patients want to see change, and where people can connect on that human level, are really important. And you really do need to cast a wide net, because people will connect at various different angles, and so you need to think about a broad way of engaging your audiences. Just before we talk about, there's two other things I want to talk about on this as well, and that's the barriers that people often face when they're thinking about sustainability and how they should be getting involved. So one of the things that people will say when they've heard about all this is, okay, I want to get involved, but you know, it's such a big area, I have no idea where I'd start. And for that, I would say try and focus on the low-hanging fruit. So that's a quick sort of project you could start that'll have quite a big impact. And so if you're in hospital, let's say look at things like anaesthetic gases, starting with the desflurane to sevoflurane switch is probably a bit quicker than a big product like nitrous oxide, which you want to look at later on, definitely. Or do something that you can see. So that might be like a litter pick or a tree planting session, because it's something that people will see and it's something easy to organise. And I think when you have a small success like that, that then drives more success, and people won't feel like this is such a big project that they don't know where to start, and then secondly feel like they can't make an impact. So that's what I'd say. As we said earlier on, action mitigates the anxiety. Also, I would say a take-home message is that progress is the aim, not perfection. None of us are experts in this field. You know, this is very much emerging work, and we're all learning as we go. So I would say, you know, just get involved at whatever level you can. What we've shown through our green groups and Green Health Wales is that all of us have just come with a passion to improve our sustainability, and we've brought whatever skills we have. We started with a very, you know, basic idea with 1 or 2 people just saying they were interested in this and no idea where to go in our health board, and we've grown to this level just because people have come together with a different array of skills. You know, looking at our logos, even is something we reflect on sometimes. When we first started back in 2019, this is what was drawn up and what we went with for a while, and slowly we developed into something a lot more official, and we are spreading across the country now. So you know, I know pharmacists, we often aim for perfection and we have very high standards, but I think don't let that stop you from starting. Also working in big organisations, this is sometimes how it feels, that you're sort of on your own and you're so much red tape, but I think don't underestimate the fact that there are other training opportunities, there are organisations you can link with, there are resources to help you out, but there's also people. And I think in terms of engaging, the first thing to do is to reach out to others. As you've done today, you've got a whole network of people in this conference today who have a shared interest and will help you on your way. So, you know, together you definitely can make a difference. Our contact details for our organisations are there. If you want to see what we've been up to and have some inspiration or get in touch, please feel free to do so. I will end there and happy to take any questions.
Thank you so much, Yasmina. That was really good. Loads of rounds of applause for you in the chat box. And I think you touched on something really key in terms of starting small, and no matter what level you are, you could be new to the sustainability issues, you could be very expert in this, but it doesn't matter as long as you come together and everyone brainstorm on how we can do better. And that is a good starting point, isn't it? And I know a lot of these work that you've done is in your own time, unpaid, on top of your full-time job. So well done to you. Is there any other questions in the chat box? Let me have a look. I think you might want to scroll through that. Loads of positive feedback for you and what you've done. So well done to you and the team for setting up Green Health Wales. So I think with that concludes our conference today. So Pharmacy Declares has been very keen to spread the climate and health message everywhere, and hope everyone here today have inspired you to take actions within your spheres of influence. Think about one thing you might want to pledge to do after this. Not a drastic change, but start small and it slowly embeds in your lives and it becomes habitual.